Okay, so we have the Alliance COVID Survey Series, partnering with Volunteer Mississippi. These are our 3 surveys running from March 2nd to April 24th. The process was that we developed surveys for rapid and long-term responses to COVID-19. We partner with Alliance and Volunteer Mississippi Hub Network. We are collating the survey data, responses, and trends for our national, state, and local partners listed there. We are going to cultivate an informed, strategic, and collaborative response to the crisis. This is our Mississippi Hub Network, which we are very proud of, and Volunteer Mississippi and has worked very hard to get this started, and we are partners with them. They're the volunteer and nonprofit hubs across the state. This is the primary mechanism for how we're getting this information disseminated and gathered. And these folks are doing a fantastic job. The scope of the surveys, the directors document responses and match needs with support mechanisms, and they're vital link to the communities by providing services like capturing and documenting the local narratives, linking people for services and solutions, providing volunteers as social distancing allows, following CDC FEMA guidelines, and forwarding support request forms and that data to the Alliance for action. Our community impact survey, we did a preliminary summary report as of 3/29, March 29th, really before the details of the CARES Act became public. We wanted to get an immediate capture of what people were saying. We collated 113 responses representing the entire state. And the key messages were that community collaboration is strong and producing immediate assistance. COVID-19 social distancing really contributed to a decrease in volunteerism. Technology support is needed for both nonprofits, organizations, and communities. And nonprofits stated that some are not at service capacity and could serve more people if they had more funding and supplies. The survey trends for philanthropies were that nonprofits need crisis funding and long-term funding as unemployment numbers rise and vulnerable populations increase, and they need supplies of all types. The Community Impact Survey preliminary report is at this link. It's also in the archives. And we will be adding to that when the survey closes tomorrow. The philanthropic response survey, we had 9 people represented as of, well, actually as of today. The key messages were that the grantees need crisis funding, extended time to meet deadlines, and modifications of program delivery restraints. Philanthropy normal operations have been impacted by staggered schedule, working remotely, policy changes, and virtual counseling. And they told us that the Alliance can provide communication flow for funders, meeting software recommendations, survey responses, and can convene the Education Affinity Group. So the concluded philanthropic response survey report will be completed after the April 24th extended closeout date. So if anybody would like to participate in these, at the end of this slideshow, we've got a mechanism for you to do that. And we encourage anybody to do this to give us more information. The Economic Impact Survey preliminary report, we had 37 representing the state, and 30% of the respondents planned to apply for Federal CARES Act assistance, and 23 indicated that they were considering applying. So when you put those two numbers together, that's a pretty high percentage. Unfortunately, 374 nonprofit sector employees have been furloughed or laid off, according to our 47 summary survey responses. Respondents revealed that a small number of their affected employees were receiving other assistance at the time of separation. And they also revealed that most did not have the capacity to give furloughed employees assistance at this time, but would consider it if funding became available. 51% of the respondents revealed that they would bring back their furloughed laid-off employees. The same percentage would like some technical assistance in completing the federal grant forms. 77%, which is high, would like the Alliance to share their survey information with available resource organizations. And the salary survey data positions of laid-off employees was unreliable due to diversity of responses. We had anything from $5 an hour up to $800,073. Actually, obviously that was an annual sum, and everything in between was reported with the salary survey. So we'll have to dig into that data a little more. The economic impact survey is going to be completed after April 24th, and we will have another report coming out by May the 1st, a conclusive report with all the data. There's still time to let you hear from us. Use the chat feature and type your name and the survey you would like to complete, and we will send you the link below to participate in these surveys. And there are the 3 surveys we're doing and the support services form. And if you'd like a link to our previous webinars, it's listed here. This is how you can become part of the Alliance if you're so inclined. And that concludes my presentation.
Give it another minute or so.
Will now be recorded.
All right, about 1 more minute, we're gonna get started back up here. Okay, just to make sure we are being good with our time, Mary Ellen, do you want to go ahead? I'm going to make you a presenter again, and let's pick up where you left off.
Dave, I think she was finished.
Say again.
Yeah,
Oh, she had finished?
Mm-hmm.
Oh, perfect. Okay. Wonderful. All right. Well, with that then, I don't know what happened with mine. Mine must have just dropped out a little too early. So with that, then we're going to go ahead and pivot, and I'm going to introduce Caitlin Brooking, who will talk about volunteer and donation coordination in disaster. And Caitlin, you can fire away.
All right. Good morning, folks. I'm just going to talk a little bit briefly about what the response looks like on the state level and where Volunteer Mississippi and volunteer organizations in general fall within the infrastructure of the statewide emergency response. So you may or may not know that MEMA, which is Mississippi Emergency Management Agency, has a comprehensive emergency management plan, or a CEMP. Lots of acronyms, try not to use them without defining them. It is visible on their website, which is msema.org, if you're interested in reading it. But this is a plan that is organized by what we call emergency support functions, or ESFs. And the work that has to be done during, immediately after, and during long-term recovery is all organized in that document by state agency and some NGOs. So We are one of 16 ESFs. We fall under ESF 6, which is colloquially known as mass care, but it's actually mass care, emergency assistance, housing, and human services support function. So under that function, what that actually means is that these are activities that provide shelter and temporary housing, feeding, and other human needs, such as medical care, some economic assistance. But that's kind of the area of work voluntary organizations tend to fall into. There's plenty of other ones, the roads, the power structure, firefighting. If you look on the MEMA website, it lays them all out. So we're one of 16 ESFs within that state infrastructure. For ESF 6, the Mississippi Department of Human Services is actually the coordinating agency. So they're kind of the boss of all of these functions. And we are one support agency among many, maybe about 20 support agencies, including the institutions of higher learning, IHL, community colleges, mental health, rehab services, agriculture, extension services, etc. So there are a few NGOs, non-governmental organizations within this structure as well. NGOs are very rare within the state infrastructure, but some state level agencies are in there, including the American Red Cross, the Salvation Army, and the Mississippi Voluntary Organizations Active in Disaster, or VOAD. Those are the three that are listed in this ESF. And I've mentioned this a couple times, but the activities that are coordinated at the ESF level are statewide throughout emergency management. And if you've ever been to one of my workshops, so hub director, sorry, I'm sure you've heard this 1,000 times, but the state assumes that disasters start and end locally. So our function is to support the local operations on the ground, but local communities are the leaders who kind of set the strategy for how a community begins to respond and recover. And the state agencies that are involved are there to support those plans. We don't come in and tell you what to do or what we're going to do. We offer support services so that you can carry out your strategy for recovery and response. So I did want to emphasize that fact. I'm hearing a lot from the agencies on the ground kind of asking if they have the jurisdiction to do this and do that. Local communities are our boss in this effort. So I did want to emphasize that point. And our goal is to actually work ourselves out of a job. So we come in, offer support services, try to bring resources to local agencies who are acting. Our goal is to sustain local organizations, help them get back on their feet, restore operations, and move on when the local agencies are stable. So that's kind of our goal when we're responding to an event. So our agency, the Mississippi Commission for Volunteer Service, or Volunteer Mississippi, is tasked with the coordination of volunteers and donations, again, at that state level. A lot of times after a disaster, a local church, the local United Way, agencies that serve the public every day are the ones who step up, manage volunteers, manage donations. So we can support those agencies if possible, and that's our preference. We follow your lead. We also work during Blue Skies to prepare and support local agencies and government to manage volunteers and donations. So a lot of the work that we actually do in this sector is around training, kind of helping people gather coalitions to prepare. We talk a lot about how you might manage volunteers in a disaster, how you might match volunteers with safe organized opportunities to volunteer in the response. Our goal is actually for everyone to be an affiliated volunteer and be trained to carry out certain activities. Of course, that's not always what happens. People hear about something happening in their own community or neighboring community and they want to help. We don't stand in the way of that at all. Our goal is to help channel that desire to help to opportunities that engage people safely and efficiently as a resource to carry out the response plan. So we do operate at kind of the 5,000 foot level. Our goal is to identify gaps in service. So things that are going well, you know, if the Red Cross is there feeding people, great. We're going to look at maybe what communities don't have a Red Cross or a Salvation Army who are there supporting those people and move resources to those places where people need it most. In order to do that, our agency is very small. We have 9 staff members and there are 82 counties. So we can't be everywhere at once. We usually do not go to the place that has had a disaster, but we try to move resources towards that place as quickly as possible. We rely on a lot of partners. We try to make as many friends as possible. Many of you are in the room today. Hubs, big shout out. The hubs are one of our main and most crucial partners in this work because they're on the ground every day, building relationships with nonprofits, managing volunteers, and in a disaster, those relationships are how communities get back on their feet very quickly. So we treasure our partnership with the hubs and with the Alliance very much. Another one of our major partners I mentioned is VOAD, Voluntary Organizations Active in Disaster. This is a group of specialized disaster response NGOs. In our state, they are mostly faith-based organizations, and we've got some chapters of national organizations such as Team Rubicon, who also respond to disasters. And they all have different specialized functions, but they are kind of the strike teams that do things like clearing debris. They all have, some of them have chainsaws, so they come and cut up trees that have fallen. Some of them are good at tarping roofs. Some of them are good at mucking and gutting after a flood. So that is a statewide conglomeration of smaller groups with specialized skills in disaster response. And they are a huge partner for us as well immediately after a disaster happens, because they mobilize specialized volunteers quickly. They already have systems in place to organize their volunteer crews. You know, everybody's registered, they know who they are, they know how to contact them, and they're able to mobilize very quickly to meet a specific need. So that's VOAD. We are 2 different organizations. Sometimes there's confusion about that. But what Volunteer Mississippi does is kind of at that 5,000 foot level, trying to help place volunteer resources where they're needed and where there are gaps in service. One way that we specifically tend to manifest in the disaster is by managing what we call unaffiliated volunteers. The VOAD groups, those are what we call affiliated. They've got you know, a list of volunteers they can call down. Their volunteers have received specialized training. You know, they've filled out the forms. They've done the liability forms, our favorite buzzword. They've got the training that they need to do what they do. We try to organize folks the kind of folks who see something happen on the news and they want to help. So our goal is to collect all of those folks together in a centralized place. For this particular disaster, because of social distancing and safety measures, we are doing this all virtually. So our goal is to collect those folks and offer them opportunities to serve either with affiliated organizations or with local nonprofits who are responding. So basically what that means in this case is people are pre-registering online with a short form. They're getting emails every day that say, hi, thank you for volunteering. As soon as we have organized opportunities, we will let you know what they are and you can sign up according to your availability and what you want to do. On the other end, we are drumming up volunteer opportunities with groups who are responding. In this case, we'll be working with Samaritan's Purse, Team Rubicon, 8 Days of Hope, and Team Hope to hopefully place unaffiliated volunteers with those groups to serve in the field. And then the hubs, actually part of their job is in the regions that they serve to actually make those matches. So most times, in most cases, disasters are localized. There's a tornado in one town. So that's, pretty discrete where that area is. In this case, we've got a worldwide disaster happening, and then one localized tornado, well, across 4 counties. So it's an extra challenge to organize all that effort because there's multiple places where they need to be organized. But the Southeast Hub is going to be working with us on the tornado response, which we really appreciate, in kind of a regional way across a few counties. So it's a lot of 5,000 foot level coordination that's going on. Usually Volunteer Mississippi is behind the scenes. We're not necessarily boots on the ground, but we are trying to look at the big picture and see where the resources that we can coordinate would be most efficient. And we try to reduce chaos. We try to place those resources in safe places where they can be immediately deployed. And again, our goal is to support what already exists in the community. We want organizations that serve those communities every day to be back on their feet, serving the people that know them and that trust them. And we want all the resources to go to those agencies as much as possible. So I think that is the end of my spiel about the state level disaster response around volunteers and donations. Are there any questions?
Here. What is the best federal and or state stimulus package for small faith-based 501c3 to apply for a fund? So Rebecca, if you want to reach out to us separately, we can link you with our webinar and our resources to help you answer that, specifically looking for funds. Any other questions for Caitlin before we switch over to Krista? All right, Caitlin, thank you so much for taking the time to be here. I know that you and your team are incredibly busy, and I should have said this from the onset, and want to acknowledge that the lives that were lost and have been lost from COVID-19, we've also lost several souls here in Mississippi from the tornadoes this last weekend. And so Mississippi's taking a hit right now. I know that we're all working hard to make sure that we can support our communities in any manner that they may need from any disaster. And so thank you for the work that you're doing and your team, and good luck with everything coming up in the future. And so with that, I'm going to turn it over to Krista, who is, I'm going to make you presenter, who is going to talk to us about 211. All right, Krista, floor is yours.
Okay. Am I on? All right.
Yes.
Morning, everybody. And I want to thank the Alliance so much for having these weekly webinars. It's been very helpful to us, and I think it's been helpful to many of you to tune in as we're all sitting in our home offices, or most of us, and feeling like we're the only ones out there. And it feels good to see everybody's face, or at least their names up there. So thank you very much to the Alliance and for all of the resources that you are always providing to us, especially now during this pandemic. And I want to thank of course, all of our hub directors, the Mississippi Hub Network, for all the work that they're doing in the local communities. We appreciate you very much. Dave has called this a 211 effort, or the 211 hotline. And the reason for that is that, well, let me start from the beginning. With the pandemic going on right now, we have a lot more of our neighbors out there who are becoming unemployed and needing, we have a marked increase of people needing very basic things now, food and clothing and shelter, financial assistance, and goods, help with utilities, things like that. And so we know that the nonprofits who help to provide those things are becoming very overwhelmed. And in addition to that, we know that the governmental and non-governmental organizations out there who are providing those things have had to alter some hours, or some of them are no longer able to provide services. And what we have decided to do, and what we can do through the help of 211, is we are attempting to update some of these services to get current information on those organizations, both government and non-government, that are offering, that are providing basic service to folks out there, and try to keep up with who is out there doing it now, so that when people are calling and they need these services, we know where to send them, and that 211 knows where to send them. If you are not familiar with 211, it is basically an information line where individuals can call and find the kind of services that they need. And it's usually through a United Way, and we thank the United Ways for supporting these information lines. And right now is kind of an opportune, well, a good opportunity for us to be able to update these lists through some of our AmeriCorps members, because right now our AmeriCorps members, some of them are not able to go out and do the boots on the ground good work that they usually do. They're at home like us, and so they can take some time to update these organizations. And it's through a very, very simple form that we've created, and I'm going to share that form with you. We're just asking for updated contact information, the types of services provided, and then we also want to know any kind of organizational changes or closures, differences in the kinds of services you can provide right now. What is, are you able to continue providing the things that you normally do, or, you know, is that, is it different now? So that we can, and also, excuse me, also we want to know if there are any unmet needs that we might be able to help with us or our partners, the Alliance, or the Mississippi Hub Network. So we are going to share, please, the link with you if you are actually one of those organizations that is a food pantry or feeds people, or is able to provide material goods like clothing, diapers, hygiene items, baby formula, and other goods. We're also looking at sheltering, housing options, utility assistance, employment and education opportunities, healthcare, and disaster relief, because that's going on right now too, elder and senior care. Those are the ones that we are starting with, that we're having our AmeriCorps members to update and make sure we've got current information on those, and then we'll be sharing those out on a daily basis. The good news is that once we've got these lists all updated and the types of services that are provided, we can share that back with 211, but then we can also keep these lists updated at the hub level, at the local level, at all of our 8 hubs out there, so that they too have this information and have it on hand for anybody who may need assistance. And as I said, I'm going to go ahead and share that link. If any of you could provide these kinds of services, if you could please fill this out, and we could keep you up to date, and we could put you in the hands of 211 for those kinds of calls that come into them, and also for our hub partners out there. So this is something good for us now, but it's also a wonderful resource for us to have as we move forward into the future. Just to be able to have all of those names and resources in one place is very helpful for the hubs, but it's also helpful for us in a disaster like the tornadoes that have just hit, to have the resources up front so that we're prepared and we can recover faster. And I will leave it up to, if any of you have any questions, I'd be happy to answer any of them for you. And thank you very much for all you're doing out there.
All right. Thank you, Krista, for that. And we have Teresa Erickson, who's asking, does 211 publish the info?
I can find out for you. I know they have a website that has the information on it. I don't know that it's, I'll have to ask about that, but what I can say is that we'd be happy to share it with you. When we have compiled the list, we'd be happy to share that with you.
Wonderful. And I just saw that Gary posted the 211 website. It's not up to date yet, but that is the link to the website. Right. And I'm sure there will be lots of updates to come. So yes. Thank you, Krista. And we'll have time at the end for more Q&A. So if you aren't sure what to ask, or you're not able to type it fast enough, no worries. We'll have an open mic Q&A in just a little bit. So with that, I'm going to go ahead and turn it over to Rebecca Nelson. She is the volunteer hub director. The Mississippi Volunteer Network Hub Director for Northeast Mississippi. So with that, Rebecca, if you will take the floor, introduce yourself, and tell us about some great things that you are working on up there with your team.
Great. Thank you, and I appreciate the opportunity to talk to everyone this morning. As Dave said, I am Rebecca Nelson. I'm the director of the Volunteer Hub in the Northeast part of the state. There are 7 other hub directors, and for their sake, I want them to know that I'm going to set the bar very low so that when you have your turn to speak about your hub, it will be very easy for you to surpass the expectations I'm setting up today, because I am not the techno-savvy one. I have made my notes on paper, and Dave will have to put up the documents that I have toward the end of what I want to say. First, I want to say that in all of Mississippi, I am sure, but I'm going to specify in Northeast Mississippi, we are doing an amazing job of getting through this COVID-19 crisis. The nonprofits that I see predominantly are the food pantries and the feeding services that have had to make changes to make sure people get those very basic needs. And they're dealing with 2 different problems at the same time. One is that there is an increased number of clients, as you can imagine, because so many people have lost their jobs recently or have been furloughed. And 2, they're working with fewer volunteers because either they have relied up until now on retirees who do not feel safe getting out and volunteering, or with the need to keep social distancing, which means that you can only have a certain number of volunteers in a given space. But they are continuing to make those changes. For example, Faith Food Pantry in Nettleton has moved to I think this is called a rolling or a drive-through pantry. This Saturday, the Mid-South Food Bank out of Memphis will be bringing their 18-wheeler into the parking lot at Faith Food Pantry and will set up pallets of food at least 6 feet apart. And clients will simply drive past the pallets and stop at each one, and volunteers will put the food in their cars. And when they get to the end of the line, they're done and they just drive out. So this is a new process for them. I've seen it done once in Corinth and it's very successful. But if they hadn't been able to move to this model, they might not have been able to operate at all. And Mr. Long in Nettleton did not feel comfortable stopping that service. So we applaud him. Another success story is Saints Brew in Tupelo. It operates out of All Saints Episcopal Church. And normally they feed breakfast Monday through Friday to about 80 clients. It's a sit-down breakfast. It's lovely. The clients have a chance to talk with each other and just have a little social time while they get a nutritious breakfast. But they have had to change their model to go to a carry-out, but it's still working. They have a system where the clients simply come to the outside door. Breakfast has already been created. It's just put in a bag and they get it to go. And, you know, they're still serving the people who need that service. So I'm excited about those types of changes that are happening in Northeast Mississippi. On the other end of the spectrum, and I say the spectrum in terms of what feeds us, those two examples were about what feeds the body. One of our nonprofits in Northeast Mississippi that feeds the soul is the Oxford Film Festival, which normally would have taken place in March. But they have made a change as well, and they will be going to a virtual film festival beginning the week of April 24th to May 1st. They will they will be showing films based on a certain theme every week, and they will still have Q&A sessions with the filmmakers, and it's going to be a great production. It's just another way that our nonprofits are doing whatever they have to do to bring their services to their clientele. I also want to point out that United Way of Northeast Mississippi has a COVID-19 relief fund, which has brought in lots of funding to help clients with utilities, diapers, formula, all kinds of basic needs, as well as to offer the option of feeding the front line, which is where they are providing food for the COVID-19 medical staff at the North Mississippi Medical Center. So those are some of our positive highlights, but of course we still have some challenges to face. In addition to the ones that Krista mentioned, I think we have to remember that a lot of our nonprofits offer services such as tutoring and rehab, therapy. Those kinds of things are still being done virtually, but it's very difficult, and we recognize that, and we applaud the efforts to make those things happen in whatever way the agencies can make those happen. Regarding the 211 that Krista mentioned, I will say that I sent out that form to all of the agencies in the northeast part of the state for whom I have contact information. So that information is out there. Please take the time to fill those out. In addition, while you're probably working from home and possibly have some downtime, this is a really good time for our nonprofits to update their websites and their social media pages. You know, people rely on those for information. So if you would just take some time to look at your websites as though you don't know anything about your organization and find out, well, if someone wanted to call us or email us or find out our hours or what services we provide, is it easy for them to find that information on your website or on your social media pages? If not, this is the time to update those, and I'd be glad to help you with any of those you'd like to do. In addition, I would love for you to take some time to either acquaint or reacquaint yourselves with the websites that I have. And I think they're on the screen, Dave. That first one where you see the big orange bar across the top. I guess everyone is seeing the same thing I'm seeing. I see three screens. Is that correct, Dave?
Mm-hmm. Yes.
Okay. Okay, good. The one with the big orange banner across the top is the Galaxy Digital or the Get Connected page. We've called it 100 different things. We're really trying to call it the Mississippi Hub Network. That's those 8 hubs that we've talked about. And this is the one that belongs to Volunteer Northeast Mississippi. This is where you as the agency can go and post your own volunteer needs. And you'll see now that we have 3 big spotlights up, but this is not by any means the limit of our volunteer opportunities that are listed. We just happen right now to have a link for some COVID-19 resources, for tornado relief efforts, which is where the form is posted, the one that Caitlin talked about, and ways that our food pantries and feeding programs could use your help. So that's what's listed there. There is another website that I have that's just Volunteer Northeast Mississippi in general, not just the volunteer opportunities. But it's when you go to that one, you can see all kinds of information. For example, all of our newsletters that we've published, any events that are coming up, although all events at this point have been canceled for the time being. And you'll even see links. For example, if you look at the screen underneath the one that I was talking about first, where you see the 3 blue bars, all of those will take you to that Galaxy Digital website. So you can move back and forth between my 2 websites. And then I want to look at the last one where I have my contact information. And I want you to know that there really is quite a network here between the hubs and Alliance and Volunteer Mississippi and Caitlin, who covers Dovia and VOAD and all those other agencies with the initials that I can't remember. But if you ever have any questions at all and you don't know who to contact your hub director. We are the ones who can find out the information. We'll know who to call or how to get that information. So please, if you want to contact me, you see my information there, my phone number. I am located in the United Way office, but I do not limit myself to United Way agencies. None of the hubs are limited at all to our community foundation agencies. We try to represent everyone. So please give us a call, go to our websites, reach out to us, because we are in place to help you do what you do best. And I will close by thanking everyone for the hard work you do every day, but especially during this COVID-19 pandemic. And I want to just say, keep doing what you're doing, because we are Mississippians, we help each other, and we've got this.
Thank you, Rebecca. That is terrific, and you are doing a whole lot of work up there. So thank you for what you're doing and what you continue to do. Really appreciate it, and we look forward to having you back for more updates in the future. With that, it is 9:56. I want to be mindful of the time. So we have run out of time for Q&A. If you want to enter your question in the chat, we'll be able to download that, and so we can send that to our presenters and share that out. I do want to make a few announcements. Tomorrow is our quarterly meeting, and at the end we'll have Dr. Mary Curie and the former head of the State Health Department, and Jeffrey Moore, the Chief Strategy Officer at Independent Sector, and they will be on from 11 to 12:30. So I'm going to share the information for that, so you can access that that meeting in the chat. And so the other thing I will take a note at, so pay attention to the chat. I'll put that up in just a second. Is again that we have our document resource archive, and so definitely check that out. Keep your eyes peeled for emails coming from us that have those links, and you'll be able to access any of the resources from this webinar and previous webinars, including the support request form. So if you are looking for help with your organization, or you know others who are looking for support, definitely fill that out and we'll get you connected. Make sure to check out the Alliance website, alliancems.org. We'll post updates. We have a special dedicated page for COVID-19. And I want to give a special thanks to all of our presenters for being so gracious with your time today and taking the time to be here. Mary Ellen, Caitlin, Krista, Rebecca, you're all doing amazing work. We really appreciate it, and we look forward to having you back in the future. And so with that, everybody have a terrific day, and I'm going to post in the chat right now the link to tomorrow's webinar, the quarterly meeting webinar, so that way if you would like to attend and hear from Mary Currier or Jeffrey Moore, you can do so. So thanks, and have a wonderful, wonderful day.